Well, as of tomorrow, it will be 1 full month since the Lamentation Mountain brush fire in Berlin started up. Since then, a lot more brush fires have sparked in our state and across the Northeast, so much so that we've decided to make it the topic of our weekly Health Watch segment. As always, we're joined by Dr. Syed Hussain from Trinity Health of New England. Doctor, a pleasure to see you again.
Likewise.
Yeah, glad to have you here talking about the problems that these brush fires and more specifically the smoke that comes from them can have on our health. Why don't we talk about who tends to be the most vulnerable? Let's start there.
Yeah, Tim, we're seeing more and more of these, by the way, take place now.
Yeah.
And children, adults over the age of 65, pregnant women, those that have an immunocompromised underlying condition, medical condition, or those individuals that may have multiple medical problems like heart failure, asthma, COPD, any type of lung issue. Those are all folks that are more vulnerable to wildfire smoke.
And when it comes to the lungs, what are the biggest problems and the biggest symptoms you start seeing?
So let's talk a little bit about the wildfire smoke pollution. What exactly happens? So they're very, very fine particles. There's particle pollution. So they're liquid and solid particles, tiny, minuscule, Tim.
Yeah.
So small that it would be probably a third of a single hair follicle diameter.
Yeah, okay, so we're talking about particles you can't see.
Yeah, absolutely. So those will go deep into the lungs, will coat your lungs. So people, especially with underlying medical problems that impact the lungs, COPD, asthma, for instance, will get an asthma attack or will have difficulty breathing, will have experience wheezing, and those symptoms related to the respiratory tract.
All right. What about other bodily processes? What about the skin? What about the eyes? Other membranes that are thinner?
It can be an irritant to skin. It can be an irritant to eyes, so your eyes might water. It can be bad to other organs as well. So overall, the effects, multi-system effects, are not good. But, you know, especially those that have an underlying condition, they need to take precautions. And one thing that viewers need to keep in mind, especially as we go in and out of these days that are good or bad, is looking at the air quality index.
Yeah, let's talk about that.
Yeah, so anything less than 50 is good. That's good air, good to breathe, safe to breathe. Anything above 100 with underlying medical problems is that when you start needing to take precautions. Anything above 300 is bad.
Yeah, and I don't think we've ever gotten to 300, but there's been times in the past where we've seen a lot of that smoke come in because it can come on different levels. So, there was a couple of years ago, we were seeing wildfires in Canada.
It was all coming down here.
It was coming here, but it was staying in the upper atmosphere, so it wasn't really affecting how we breathe. It was affecting the sunrises, the sunsets, the air quality. This seems to be a little different, and I know we were talking about people in Western Connecticut complaining about physically smelling the smoke from a fire in Great Barrington, Massachusetts.
That's right.
I'm guessing if you're getting to the point where you can smell it, then that means...
It is, and that's why I always tell folks, always look at the air quality index in your town, in your city where you live, so you can take some extra precautions. And what are those precautions, if we want to talk about them? Include, you know, if you have underlying medical problems, use a respirator. Make sure that it's a well-fitted mask that you can use, especially if you're going out. Try to stay indoors. If you have air conditioning, try to use that. You know, if there's a HEPA filter, that's great. And try not to cook or smoke indoors. Try to keep that air inside the house where you live as clean as possible. Don't open the windows. You know, common sense things help, but make sure you wear a well-fitted mask if you do have to go outdoors. And also, make sure you have an evacuation plan, especially if you live in an area that is close or considered close to an active wildfire site. Make sure you have adequate food and medications as well.
Yes, thankfully, we have not gotten to that point, especially with people in Berlin, where that Lamentation Mountain brush fire was very, very close to where people live, but looks like that managed to pass over without people having to leave their homes. So stay inside. You should be all right. Doctor, I know a lot to get to. As always, we enjoy having Dr. Syed Hussain from Trinity Health of New England here to give us some best practices to stay healthy. Erica, let's send it back to you.
All right, good stuff. Thank you.